Threats, opportunities, solutions for changing times. And everybody is aware in dentistry that things have changed rather radically, and they will continue to change, not just because of government intervention, but by the year 2020, there are 20 new dental schools slated to be open in the United States. This will create raging competition. There is no plan to change this whatsoever. There will be more competition in every specialty of dentistry, including the specialty of general dentistry. The question that all of us have is, how will you distinguish yourself and your business practices to best the competition? Individual competition as well as corporate competition. Therefore, Gay, Lowry, and I have put together a program January 23rd and 24th. That's a Friday and Saturday, concluding Saturday at 1 o'clock, that will directly address these issues. For example, the impact of practice image, the impact of customer service, understanding the decision-making styles that different people have. Decision-making styles. Specifically, what will we address with that, Gay?
Well, I think we often make a mistake and assume that everyone learns at the same pace, that everyone understands what we're offering as far as whether it's orthodontics or general dentistry or implant surgery. We assume that they just understand, or they believe us that it needs to be done because we, the professionals, have recommended it. And we don't take time to learn that parent, that customer, that patient well enough to understand what their decision-making styles are. Whether there's someone who can make a snap decision, or they need to consider all of the options, they need to do the appropriate research. We're often very wrapped around closing the deal. We've got to close that sale. We push and push to close the sale and to make sure that we have the production and the revenue that we need. It's very, very important to understand the psychology behind the decision making for that patient or that parent that we are talking to.
And that addresses the image that each of you is trying to portray to the public, because that image will translate to your brand, which is another way of saying the promise that you make to people about your particular business. One of the other things that is quite interesting these days in successful businesses is the idea of productivity. What do we mean by productivity as opposed to profit being the bottom line, Gay?
Well, productivity, of course, being the services that we provide that actually produce the revenue, that contribute to the bottom line. But our productivity is affected by much more than simply the number of services that we provide in a particular month, because our reputation, as we've talked about, our image affects our ability to be able to encourage more patients into the office and to make patients feel comfortable with us.
When we think about, like if I think about friendships, people that I'm friends with do something consistently, and that is that they show me that they care about me. And the research that I did back in the 80s was very specific, that the way you demonstrate to people you care about them is you meet their needs. If the staff meets the doctor's needs, if the doctor meets the staff's needs, and if all meet the parent/patient's needs, the business is quite productive, and productivity is a product of that. It's not the key objective for the successful business, for the business that will make it in the long run and best the competition. One of the things that we talked about doing, Gay, was if you look at the write-up, you will notice that it says the real deal, and participating in the idea about actually sending surveys to all of the course participants that you will fill out. You will find that here on this sheet where it says the real deal, and a questionnaire will be sent to all registrants where we would like you to identify different areas so that we can understand the marketing of your specific area and see which areas have in common. How will we move forward with that during the meeting, Gay?
Well, we'll ask some very probing questions in the questionnaire questions about your productivity, about your revenue, your number of new patients, your number of hygiene visits that over a period of 2 or 3 years. I think we're probably going to go back to 2012 and ask for information that far back. Just a warning. Don't be intimidated by that, because we'll be able to take that information then and customize the discussion based on what we find. There will be an opportunity for you to share what your major concerns are, what information you would like to hear in the meeting, as well as for us to get to know you better. The idea is for you to be able to leave this conference with information that you can use, that translates into information that is appropriate for your practice, and not the kind of general topics that we typically get to teach about. We want this to be something that's practical application for your staff.
Therefore, we're going to keep this to a very small group.
Yes.
25 people max. And we're looking at doctors as well as the key practice managers. Some businesses we know have more than one office manager.
Yes.
And it would be important to consider those people attending the meeting. The other major area we are going to focus on is a balance between organizational and personal goals. We certainly do not intend to ignore the fact that people need a balance in their personal life as well as their professional lives. And those balances shift. The way someone keeps score isn't just the money, it's quality of life. The meeting is January 23rd and 24th, 2015 again. That's a Friday and a Saturday, concluding Saturday at 1 o'clock, limited attendance. Attendees will be sent the detailed questionnaires well in advance of the meeting. We'll look forward to seeing you then.
Thanks.
Bye.
Bye.